Hello and welcome to HealthAfrik. My name is Isabella Teteahinakwa. As you can see, I am very excited, and that is because this is the maiden edition of the Time with a Specialist, as well as the first episode of the dental edition. You know, as we bring you discussions on health-related issues, we are also dedicated to having interesting and special time for our experts in the specialized healthcare field. And this time, the focus is on dental issue, which we often overlook in our day-to-day lifestyle. So stick with us as we go for a quick break, and when we come back, I'll introduce the topic, our beautiful guest, and also start with the discussion. Please stay tuned. You're welcome back from the break. This is HealthAfrik, Time with a Specialist, specifically the dental edition. And this episode, we'll be looking at oral hygiene habits. Let me take that again. Oral hygiene habits. And I'm happy to introduce our resident guest, meaning she'll be taking us through all the issues related to dentistry, and she goes by the name Dr. Nana Akonorbea Addo-Kwafo from Dr. Martin Kerry Dentistry. Hello, Dr. Akonorbea. You're welcome to the Time with the Specialist.
Thank you.
Right. Now, before we dive into the discussion for today, which is oral hygiene habits, I'd like you to tell us about yourself and your interest in dentists.
So I'm Dr. Nana Akonorbea Addo-Kwafo. So I've been a dentist for about 5 years now. I've worked in 3 different hospitals, Kolebu Teaching Hospital, Tema General Hospital, Port Dental Clinic, and currently I work at Dr. Martin Kerry Dentistry.
Wow.
So when I was much younger, I used to visit the dentist a lot with my parents, and it piqued my interest in dentistry.
Wow.
So growing up, I wanted to know more about dentistry. Then finally, I decided to be a dentist.
Wow. And how has the journey been?
Oh, it's been great. Well, every journey has bumps, but basically I'm enjoying it. Wow. And if I'm ever given another chance, I would want to be a dentist.
That is wonderful. And we are really fortunate to have you on this edition. Now, let's start with the basic. I know when we talk about oral hygiene, it means cleanliness and also making sure that your teeth, the gum, and then the mouth is clean. Now, how important is this to our overall healthcare?
Okay, so basically oral hygiene is the practice of keeping your teeth free from decay and also keeping the other oral structures free from infection. And as we all know, the mouth is the gateway into the rest of our body. Naturally, we have bacteria in the mouth, but if your oral hygiene is poor, with time, these bacteria proliferate, you get all sorts of infections, they get out of hand, and they can spread to other areas of your body. So they can cause bacterial pneumonia, they can cause various heart conditions, they can even affect pregnancy, causing like complications like low birth weight, among others.
Wow.
So it's very essential to keep your oral hygiene clean because it goes a long way to affect the rest of your body.
I see that. So maybe you may be healthy, but due to poor hygiene, and it triggers the bacteria in your mouth, leading to other health-related. Wow, interesting. Now, what are some of the daily practice, or let me say, the good practice we as a human need to incorporate in our daily lifestyle?
Okay, so first, toothbrushing. You'd have to brush twice daily, specifically with a fluoride toothpaste. Yeah, and you have to spend at least some time brushing, at least 2 minutes to make sure that you are brushing well. Yeah. Also, flossing. I know it's something most people don't do, but basically flossing helps you reach areas of your mouth that the brush cannot reach. Yeah, so it's actually good to inculcate flossing into like your regular hygiene habits. Yeah, and also visiting the dentist regularly. So basically most people do not visit the dentist because well, they feel like they brush morning and evening, and also they are not in pain, so there's no need. But oral hygiene goes beyond just brushing.
Okay.
And as I mentioned earlier, that there are areas in your mouth that the brush may not get to. So it's good to visit a dentist at least twice a year. Then if there is anything happening, it can be picked up early and addressed before it gets too late.
Okay. These are excellent recommendations. And how about the use of is it mouthwash? People don't brush and they rely on mouthwash. How about the use of that?
Well, mouthwash, is good to use mouthwash, but I cannot stress this enough. Mouthwash cannot replace brushing because usually you have tartar on your teeth, which the mouthwash cannot remove. So you would need the brushing, but the mouthwash can be an adjunct to a better like oral hygiene.
Can we use both together? And maybe after brushing, then you use the mouthwash to rinse your mouth, and there you go. It's possible to use both.
Yeah, it's possible to use both.
Okay, now let's move to the next question or discussion. You know, the practice for an adult in the oral hygiene may be different from what you do for a child. What are the differences, or what should a parent watching us today do for his or her child in order to keep his or her oral hygiene habits?
Okay, so
as a child, what are some of the practical aspects?
Okay, so first I'll start with leadership by example.
Okay.
Yeah, so basically parents should make sure that children see them brushing. Mostly because of our routine, most parents either brush before the children wake up, or going to bed they brush after the children have gone to bed. But you have to structure your routine such that you get to brush with your kids, so that when they see you brush, at least it pushes them to also brush.
They learn from you.
Yeah, and also you can create a reward system for a toothbrushing session well done.
Wow.
So children love to be rewarded.
Okay.
So you can put in place a system where, okay, so when he brushes well for a number of times, yeah, you give the person a reward, knowing his favorite stuff or her favorite stuff. Yeah. Then also you can make toothbrushing fun for the children. So you can have an assortment of toothbrushes, different colors, and nowadays we have like different action figures and all of that. Then allow the child to choose which toothbrush he or she wants to use for each brushing session. Yeah, and also you can read to them stories about toothbrushing. Read to them stories about toothbrushing. It also piques their interest. Yeah, to want to brush their teeth. Also, you can inculcate going shopping with them and allowing them to pick a toothbrush that you feel they would want to brush with. And also when playing with their dolls, you can encourage them to brush their dolls, their action figures. It piques their interest. And it's a good habit if they pick it up from childhood.
That's very good. You made mention we should have a reward system. That is, if the child brushes his or her teeth well. How do you detect that, oh, your teeth is brushed well? Is it when you're brushing, or maybe you can look at it and say, oh, you did well with the brushing? Yeah,
so you can look at it and say, yeah, you did well with the brushing.
All right, thank you very much. Next, let's look at some misconceptions. You know, we all don't have time for our teeth. Myself, I don't remember the time going to a dentist to say, check my teeth for me, because some are afraid. They feel it is scary. Some too do not believe in brushing. They prefer the natural chewing stick. There are lots of misconceptions about oral hygiene habits. What are some, since you've worked for, I think, over 3 years, what are some you've encountered, and what are the truths about them?
Okay, so first I would like to talk about the type of toothbrush. So most people think that when you use a hard toothbrush and you scrub really hard, that is when you would be cleaning very well. But that's actually not true. Ideally, you are supposed to use a soft bristle toothbrush, because the hard toothbrush, it wears away the enamel. Then with time, it exposes the tooth to cavities. It also exposes it to sensitivity. And also when you scrub really hard or you use a hard toothbrush, it irritates the gum and causes it to move away from the tooth, which leads to exposure of the roots of the tooth, leading to all other complications. Yeah. And also there's this misconception that white teeth is equal to healthy teeth.
Okay.
That's actually not true. So we all have different colors for our teeth. We have like a range of colors. Not everyone has very white teeth. Yeah. So for dentists, our mark for good oral hygiene is not how white your teeth is, but it's the absence of cavities and also a fresh breath.
Okay.
Yeah. And also there's another misconception that once you are not in any pain, there's no need to go and see a dentist. That is actually false. You need to see a dentist as regularly as possible so that if there's anything going on, it can be picked up early. But some of the oral diseases like decay, for instance, it starts gradually. And it's when it gets to the a very bad stage, that's when you start experiencing the pain. And at that time, the treatment becomes either more expensive or it becomes difficult to save the tooth. Yeah.
You made mention there are a variety or range of colors of the teeth. Well, what are the range? Because I'm sure someone will be listening. Maybe the person will do and it is brown or it is green. Is that also natural? I mean, what are the ranges?
Okay, so children, that's the milk teeth, are very white.
Okay.
Yeah, they are very, very white. But the adult teeth is not so white because basically, so the tooth is in layers. So we have the enamel, which is white. Then we have the dentine, which is sort of yellowish. Then we have the inner part, which is the pulp. Yeah, so the enamel is kind of translucent, so it sort of reflects the color of the dentine. Yeah, so for adults, they don't have teeth as white as children. Yeah.
So when I do this and my teeth is brown, that means there's an issue because it doesn't fall.
Yeah, it doesn't fall.
Right. Thank you very much. We'll go for a quick break. When we come back, we'll dive into the role of our daily life that affects our oral hygiene habits. We are going for a quick break. When we come back, we'll continue with our discussion. Please stay tuned. You're welcome back from the break and thank you for sticking with us. This is HealthAfrik, time with a specialist, specifically the dental edition. And today we have Dr. Nana Akonorbea Addo-Kwafo. She's our resident guest for the dental edition. And before we went for the break, we were discussing some of the misconceptions and the truth about them. We are going to move on to the role of our lifestyle, which affects our oral hygiene habits. Hello, Doc.
Hello.
Thank you for being with us. So great. Now let's move to the role of our lifestyle. Let's start with the diet. You know, some people believe when they eat this food, they are very okay and there's no need to continue brushing or probably brush twice a day. What do you think some of the diets we eat that can affect our oral hygiene, and also what do you think are some of the diets we can eat to keep a good oral hygiene?
Okay, so basically I would say that what we eat goes a long way to affect the state of our teeth and our oral, the other oral structures. Yeah, so first I would like to talk about foods that are beneficial.
Okay.
So basically you would want to be eating foods like dairy products, like milk, like cheese, like yogurts. Basically, these products contain calcium, and calcium is very good for the teeth. It helps to remineralize the enamel, which makes it more resistant to decay and to sensitivity as well. Yeah, then also you can take in foods like fish, then egg yolk, so fish, salmon, mackerel, all types of fish. They contain vitamin D, and vitamin D helps with absorption of calcium, makes absorption of calcium very effective and fast. Yeah. Then also you want to go in for foods like which contain vitamin C, citrus fruits like orange, grapefruits, and certain vegetables, because they are very good with the gum. They are very good for the gum. Yeah. And when it comes to foods that you should avoid, you would want to avoid or take or consume them in smaller quantities. Yeah, so mainly sugary foods and beverages. You should try and avoid sugary foods and beverages. So sugar as like sustenance for the bacteria in the mouth. And as these bacteria feed on the sugar, they produce acids which sort of demineralize, or let's say dissolve, the enamel of the tooth.
Okay.
Yeah, so you should keep the sugary foods to a minimum. And even when you take in sugary foods, you should try and rinse after to try and get them out of your mouth.
Wow.
Yeah, also acidic foods and beverages like lemon, lime, carbonated drinks, you should try and keep them at a minimum, because those foods sort of erode the enamel, then they cause sensitivity of the teeth. So it's ideal that when you take in acidic foods, you rinse your mouth immediately to counteract the effects of the acid. Yeah. Also, excessive alcohol intake. So basically, excessive alcohol intake causes dry mouth and it causes reduced saliva production. And saliva is very essential to clean debris of the mouth and to wash away bacteria. Okay. So if you take in a lot of alcohol and you experience dry mouth, you are predisposed to getting cavities. Yeah. Also, smoking and tobacco products should also be avoided as much as possible.
Now, when you mentioned acidic, I think I've even experienced that before. I used to take vinegar, and there was a time whenever I finished taking and then I open my mouth and the air passes, I feel this sharp pain, and it becomes so weak to the extent I can't even chew. So I think the acidic is very, very true because I've experienced it before. You mentioned tobacco. What are the side effects of taking? Because I know some people smoke and they have bad color teeth. What aside that, what other side effect does tobacco and smoking affect our oral hygiene?
Okay, so aside the bad breath and the discoloration of the teeth, basically tobacco reduces the effectiveness of the immune system. So it makes it difficult for the immune system to work as it's supposed to work. That predisposes you to cavities, it disposes you to gum infection, periodontal infection, and also it makes healing after an extraction more difficult. Okay. Yeah, and you would experience more pain than someone who doesn't smoke. Also, smoking and tobacco use predisposes you to oral cancers as well.
Wow. Now, still on lifestyle, I mean, you made mention that we need to be seeing the dentist as and when. Myself, I've never been to the dentist before. So how important is it? And also, how does it affect us if we don't visit the dentist?
Okay, so visiting the dentist is very important. And I would like to say, as a thumb of rule, usually you're supposed to visit the dentist twice a year. That is every 6 months. But it would differ from person to person depending on what condition you have and what you are being treated for. You may have like shorter appointments than that. Yeah, but basically when you visit a dentist, especially if it's your first time, so you should expect that the dentist will want to gather information about you and also would like to formulate an oral health plan for you. Yeah, so some of the things you should expect is maybe a history taken, and in the history they will want to know if you've been to the dentist before, if you've had any dental procedures done for you before, if you have any medical condition, whether you're on any medications. Then afterwards, there would be a thorough exam. Then also you would have x-rays taken. The x-rays will be explained to you. Then a treatment plan will be formulated. But I would like to add that usually when you go and see a dentist, if you have any oral health goals in mind, you should let the dentist know so that they can incorporate that into your health plan.
Interesting. Now let's move to oral health conditions. I know as we move on, we'll be mentioning some, but then now, can you briefly tell us some of the health conditions? You made mention of cavity, maybe color discoloration and all that. What are some, and then what should we do, or what are some of the preventive measures we can do to avoid all these?
Okay, so there are lots of oral health conditions, but they're very common ones that we see. Tooth cavities, which is also the decay, and also gum disease, very common. Yeah, then we have oral cancers as well. Then also bad breath. Yeah, so those are like the very common ones. Though there are other common ones. Yeah, and in order to make sure that you don't get these diseases, you have to make sure you brush well. So you have to brush, as I said earlier, twice a day, morning and evening, using a fluoride toothpaste and using a soft bristled toothbrush. Yeah, and also you must visit the dentist regularly, especially for oral cancers. When they start, it may be difficult for you to pick it up, because most of them are painless from the beginning. Yeah, but an expert would be able to pick it up early for you. Yeah, and also we have to watch our diets, avoid sugary foods, as I said earlier, then taking foods that will help with the health of the gum and the teeth as well. Yeah, then avoid smoking and tobacco use.
Great. Now, when you said we should use oral is it fluoride toothpaste? Is it the ingredients? We need to check that there is a fluoride in the ingredients.
Yeah, in the ingredients.
Okay. So I'm sure there are some practical or recommendations for people who are who have medical conditions in terms of their routine or daily routine of their oral hygiene. What would be, let's say, someone suffering from diabetes? Is their daily routine different from the normal person, or what would you advise a person who is having a kind of a medical condition but want to keep an oral hygiene habit?
Okay, so for people with medical conditions, depending on the condition you have, you may have to see a dentist more regularly than every 6 months. Yeah, for diabetics, for instance, diabetes predisposes them to gum disease because it lowers their immunity. So for diabetics, it's advised that at least they see the dentist regularly for routine cleaning and routine checkup. And also with a diabetic, when there's an extraction, the healing takes much longer than any other person. Yeah, so for such people, they have to ensure that they are constantly on their medications. They should try not to default, because when they default, it goes to affect their oral health. Yeah, and for, let's say, stroke patients, sometimes their manual dexterity is compromised, so brushing becomes a bit difficult. So whichever caretaker is around them should help them in brushing, yeah, and to make sure that they brush well. And also it makes it easier if they are using electric toothbrushes, since those ones will do like most of the work for you. Yeah.
As we speak now, I'm very thirsty, so I like to ask, because when you're mentioning the diet or the regular routine, you didn't mention water. What is the connection between taking more water and oral hygiene?
Basically, water sort of hydrates the mouth. Yeah, so as you take in water constantly, it sort of washes any food particles or debris that you have left in your mouth. Yeah, and that goes a long way to help prevent cavities, because the longer these debris stay on the teeth, they feed the bacteria, then it produces acid, then at the end of the day you have like decay. So constant taking in of water helps to cleanse the mouth of debris.
Thank you very much. I think we've exhausted our time, but before we wrap up, what should be your final words for our guests? And also, since you are being the resident guest, tell us something sweet to our audience.
So I'd like to say good oral hygiene is a worthwhile lifestyle you need to adapt, because it goes a long way to affect the rest of your body. And also toothbrushing, flossing, and regular dental checkups should be in your routine.
Should someone want to see you, how would the person get to Dr. Martin Carey Dentistry? Okay,
so Dr. Martin Carey Dentistry is located at the Atlantic Mall at the Atomic Junction. And over there, we are ready to provide you with any dental service that you need. And we would be expecting you to come at least for routine checkups. Then if there's anything going on, we'll let you know. Thank you.
Thank you very much. And this is the end of this episode. That is the Time with a Specialist, specifically the dental edition with Dr. Nana Akonorbea Addo-Kwafo. Thank you, Doctor, for sharing your expertise with us. And also remember to keep the oral hygiene habits daily, because it is very, very important. And we would also like to hear from you. So share your comments, your questions, your inputs, anything on our comment section on our social media platforms, Association of African Universities, on Facebook and YouTube. And also don't forget to tune in our next episode, which will be focusing on oral hygiene devices and also demonstrations on how to use them appropriately. I am Isabella Teta Henakwa. Stay safe and be healthy. Bye.